Great, thank you. Hello everyone, and it was really great to hear the previous presentation. So now I've got to get focused on my own. I want to thank my co-researchers, Fiona Kent, Janine Dart and Amanda Anderson. We conducted this study, a pilot study in the context of dietetic student training. And the title of this presentation is one of the illustrative quotes. Okay, so the patient's voice in health professions education. Often patients play a passive role, especially in dietetics. We found that patients usually played the role of recipients of students' care when it came to dietetic training. Although in other cases, in medicine, there seems to be more interaction from some programs, and one really interesting one is a mentorship program for medical students in Montreal, where a patient living with a chronic condition actually mentors a medical student throughout their studies. However, that doesn't happen in dietetics. But patients are increasingly owning their own healthcare, and their voice is under-recognised, and our students, we wanted to find out what our students thought about it. So what we did is, for the students, students have their final 8-week placement in a hospital, and there were 34 students who embarked on this placement in acute and subacute settings. So our project was a mixed method evaluation with a pragmatist lens to explore students' experiences of seeking feedback from patients. And you can see on the screen there's a little introductory phase that they could have used if they wanted to. So either students could get feedback themselves, they could ask peers to get feedback for them, or they could ask their supervisors to get feedback. So what students did after getting the feedback were they wrote a guided reflection. They rated their experience on a Likert scale, and then at the end of the 8 weeks, we conducted focus groups using narrative interviews. And then the student reflections and then the focus groups were coded, and we used thematic analysis. Okay, so this is the responses to the Likert scale. And you can see that on the whole, they found it useful when they had to rate it. So they thought that it helped them explore their strengths and weaknesses, helped with their understanding, and enhanced their understanding of patient-centered care. The focus group themes sort of centre around the context, the content, the student learning, and the patient perspective. So one of the really interesting things that we found were how patients appreciated, well, the students perceived the patients appreciating their opinion actually being sought. The patients felt valued and listened to. But the student reactions are what I'm going to focus on mainly for this presentation. So students were often nervous or felt awkward asking for the feedback, but one of the really strong messages that came through was that they didn't think that the patient was equipped to deliver constructive feedback. They thought that the patient only gave positive comments because they didn't want to offend the student. And then that last quote, I don't know if you get so much information on how to improve your practices at a dietetic level because you probably know better than what they do. And we were like, wow, how could that be? And we had a look at using positioning theory as a way to explain that in terms of who might be the expert. Is this because they really seem to want feedback from their supervisors rather than the patient. So our reflections were the focus groups themselves were really beneficial to help students understand the benefits of positive feedback, because on the whole, the patients were really positive about the feedback that they gave the students. And why is it so difficult for students to accept positive feedback? Does our culture of the curriculum focusing on critical thinking and feedback prevent students accepting patients' positive feedback? And why do they privilege the supervisor's voice over the patient's? And so, yeah, there's a couple of questions about what the role of the clinical educator is in all of this. So that was what our next research project was going to be, but unfortunately COVID prevented us from getting a grant. And I can hear the duck, so over and out. Thanks.